Hi, it's Dr. Lewis Clark here with Frontal Lobe Neurology 101. So where is the frontal lobe? Well, guess what? It's in the front, okay? So the front part of our brain is where our frontal lobe is. And there are different areas of it, and we're not going to break those down today. But I do want to talk to you about the things that the frontal lobe does that you're not aware of. So what are the top 3 things the frontal lobe does that are unconscious? That's what we're going to talk about today, because everybody knows frontal lobe's involved in executive function and decision making and planning, in emotions and personality and our ability to think and reason. But the frontal lobe is also doing a lot of things that you may not be aware of. So I'm going to tell you the number 1 thing, and the first thing that the frontal lobe does is it inhibit, okay, the flexor muscles. Inhibit the flexor muscles. The flexor muscles are the muscles in front of your body, okay? And that includes the muscles especially in the front of the neck, all right? But also the front of the chest, and in the lower extremity, it means the muscles in the back of the leg, and also in the buttock and gluteal area, all right? So what happens if you begin to lose frontal lobe function to the muscles, the flexor muscles? What happens to them? They increase in tone. They become tighter. And so if your muscles in your front of your neck become tighter, what does your head do? It moves forward. So you end up with frontal head posture or forward head syndrome. So the first thing that happens when these muscles are not inhibited is your posture is affected. So we can tell if that's beginning to happen, right? So what's the second thing that the frontal lobe does? It inhibits something else. It inhibits sympathetics. Sympathetics are your fight or flight response. So when your body is functioning normally and you're not in an emergency, your frontal lobe inhibits your sympathetics. What happens when you go into a sympathetic response? Well, blood pressure goes up, heart rate goes up, blood sugar goes up, insulin levels, cortisol, all of these things begin to go up. Cholesterol levels go up. So when your frontal lobe is working well, if you're not in an emergency, it keeps all that down and under control. But if it's not, then you'll start to see those things express themselves. So in the office, when someone comes in, how can we tell if this is beginning to happen? We can look at blood pressure, we can look at heart rate, we can look at pulse ox, how much oxygen you have in your tissues. We can look at things with circulation, like temperature of the extremities, to see if blood flow is being shunted to the big muscles. And then we also might notice things, certain symptoms like starting to have poor digestion or poor thyroid function or sleep problems. Those are all common with overfiring sympathetics. Now, the last thing that the frontal lobe does, it's unconscious, is it modulates, okay, or inhibits the temporal lobe. The temporal lobe is moving more back to the side now, and the temporal lobe has a lot to do with emotions, okay? It has to do with memory, it has to do with smell, things like that. So, but the frontal lobe is your thinking and your reasoning. So when your frontal lobe's working well, when something happens, you think about and reason the response. But when you lose that ability, then all of a sudden you have a more of just a reaction type that comes from more the temporal lobe, which is all about just survival. And so you'll see this a lot in ADD kids, ADHD kids, that they have emotional outbursts or they have trouble controlling their emotions. And you also see it with adults and others that start having anxiety where they can't control their thoughts or even depression at times. These are all signs of a decreased functioning frontal lobe. And now you know what most people don't. Your frontal lobe is about more than just your personality. So I hope this helps you understand a little bit about why things occur. The next video is going to be about how do we get that frontal lobe doing better and working better. Until then, God bless you and live life well.